Hello, so for those of you who are new here, I have cerebral palsy, inattentive ADHD, major depressive disorder, and generalized anxiety disorder. This is a personal vlog where I go over dealing with mental health issues and trying different medications. I've tried probably well over 10 or 15 medications and reviewed them all in my channel for both depression, anxiety, as well as ADHD, and I'm currently on 12.5 milligrams of Mydayis, which is a stimulant medication used to treat ADHD, and on 10 milligrams of the antidepressant Trintellix for depression and anxiety. And one of my viewers asked if I could compare Vyvanse to Mydayis. Before taking Mydayis, I was on the stimulant Vyvanse, and I was on a really low dose, so I was on a 20 milligrams of Vyvanse, and I was only on it for a little over a month. And I have been on my current medications, which are the Trintellix and the Mydayis, for over 3 months now. So at the end of August, it will be 4 months. And so today is Wednesday, August 3rd. So I don't know if that's a very fair comparison because the stimulant Vyvanse, I only took it for a little over a month, whereas the stimulant Mydayis, I have been on it already for a couple months. But I will do my best. And also, another thing to keep in mind, the antidepressant Trintellix is also said to have some positive cognitive benefits. So my psychiatrist told me that while it's used to treat some depression, it also helps with like brain fog and other cognitive, has other cognitive benefits that she thinks will help me with ADHD. It's really difficult to tell when you're taking two different medications which medication is doing what. So just keep that in mind. When I was on Vyvanse, I did feel like within an hour or a half hour after taking it, I would get like a boost of energy, and that was great. I feel that with Mydayis as well, and I think that's part of what it's supposed to do as a stimulant medication. The only thing, though, is that with Vyvanse, after about 3 or 4 hours of taking it, I would come crashing down. So I would get a really, really bad crash. Like, the best way I can think of describing it is like a sugar crash. Like your mood really kind of changes and drops drastically. And I was starting to confuse it with depressive episodes because I also suffer from depression. And when I let my provider know, she told me that it was actually pretty common and that she had other patients also complain about the same effect of the stimulant effect, just kind of depleting within a couple hours, and then feeling really, really low. And that's one of the reasons why I stopped Vyvanse, even though it's supposed to be long acting. I just don't think it was for me. But then again, I was on a very, very low dose. And another reason why I didn't increase it is because it was also giving me some stomach issues and it was giving me diarrhea. So the diarrhea combined with the kind of depressive episodes and crashes that it was causing made me come off it and try a different medication, which is the Mydayis, the 12.5 milligrams that I'm on right now. For the Mydayis, I also feel the boost of energy in the morning when I take it. Ideally, you always want to take your stimulant medication in the morning as early as possible, of course. With Vyvanse, like I said, I came crashing down pretty fast, but with Mydayis, I don't have that problem. I feel like it goes all day long. In fact, if I take it late in the morning or in the afternoon, I actually won't be able to sleep. So that's a problem that I've had, and that's why I've had to start taking it early in the morning, like around 7. Lately, I have been experiencing nausea and migraines, and I think partially part of that is because I'm taking both medications in the morning and haven't been taking having breakfast with the medication, and I think that it upsets my stomach. The doctor didn't specifically say that the medication has to be taken with breakfast, but because my body tends to have strong reactions to medication, it's probably best if I do take it the antidepressant and the Mydayis with breakfast in the morning, but I feel that I'm like in such a hurry every morning that I never really get a chance to, and that might be leading to the nausea and the migraines that I have been experiencing. I'm trying to get into the habit of eating a snack or something prior to taking my medication, learning to slow down for 5 to 10 minutes um, to have enough time to eat my breakfast before taking medication, and I'm hoping that will help with the nausea. It doesn't happen every day, and it's not unbearable, which is why I'm still on these two medications. Um, but other than that, I can't really think of anything else to compare the two. Um, like I said, I wasn't on the Vyvanse for very long, and I wasn't on it and it wasn't a very high dose. It was only 20 milligrams, and I tend to stick to low doses because of the medication sensitivity that I've experienced in the past. So just because it didn't work for me doesn't mean it won't work for you. We all metabolize medication differently, and our bodies are different. So you may not experience the crash that I experienced in the afternoon, and you may not experience the nausea that I experienced with the Vyvanse. So I have reviewed a ton of different medication, both stimulant and non-stimulant medications for ADHD, and a ton of different antidepressants on my channel if you want to check them out. I have said this before, but I will say it again. Finding the medication and the medication combination that works for you, especially if you have comorbid conditions like depression, anxiety, ADHD, is a lot of trial and error. It's a lot of trying medication for a month, finding out it doesn't work, maybe increasing or decreasing the dose. And then, if it still doesn't work, you move on to the next one, you move on to the next combination. And I have been doing that for like the past 2 years. And so with the Vyvanse, the 12.5 milligrams of Vyvanse and the 10 milligrams of Trintellix that I'm currently on seems to be working okay with me. For me, the side effects aren't too adverse. I might talk to my provider about possibly increasing the dose of this stimulant medication and see what she thinks. But another thing to keep in mind if you're thinking about going on medication, if you have comorbid conditions like you have anxiety and ADHD, which are often kind of go hand in hand, or depression and ADHD, and you may get a stimulant medication and an antidepressant, be sure to mention that to your provider and ask how those two medications will, interact with one another, and if it's okay to take both, what reactions they might have. Like my provider told me, the Trintellix, she felt like it was the best antidepressant for me because of those positive cognitive effects that it has aside from just lifting my moods. She felt it would also help with some of my ADHD symptoms. And I mean, it's like it varies from day to day, I guess. Some days I feel like I have motivation and energy and I can stay on task. And then I have days where it's like I can't. I think that's just part of life. Maybe increasing my medication might help with that a little. But yeah, I can't really think of anything else to talk about in regards to comparing those two stimulant medications, the Vyvanse and the Mydayis. But if you have any questions or comments, be sure to leave them down below and I will do my best to answer them. And yeah, that's it for now. Thank you.